Hi guys, I'm Sagree and I would like to share my story with you as to how I found out I have lupus, systemic lupus erythematosus. So this is basically an introductory video that I wanted to do for you guys just so that you know what my YouTube channel is about. And I would like to start by sharing my story with you guys. So firstly, what is lupus? Lupus is a chronic inflammatory autoimmune disease whereby the immune system attacks healthy organs and tissues instead of foreign invaders like germs and bacteria. Lupus, systemic lupus erythematosus, can affect your brain, lungs, kidneys, blood, liver, skin, and the heart. Lupus affects men, women, and children, mostly women of childbearing age. My journey with lupus started in 2014 when I began presenting with a very complex set of symptoms that would vary from time to time. I was admitted to hospital for 14 days. I was extremely weak. I had lost over 20 kilograms, low-grade fever, and joint pains. And after a series of blood tests and investigations, I was diagnosed by a physician with Graves' disease, which is an autoimmune disease that affects the thyroid gland, causing it to become overactive. Fast forward a few months later, I had blood work done, and doctor confirmed there is no trace of Graves' disease, and I should be feeling better by now. However, I was not well. In fact, I had persisting symptoms that didn't make any sense. At times, I even felt, as a healthcare worker, as a nurse myself, I was left confused by all these strange symptoms. Lupus is known as a great imitator, as it can masquerade a whole host of other illnesses and diseases. It is difficult to diagnose and complex in nature. A person can suffer a long time before arriving at a definite diagnosis. I think one of the reasons why a lupus patient can be dismissed is because we don't look sick. I'm sure that you hear that very often if you have lupus or you tell somebody that you've been diagnosed with lupus. And people and doctors tend to dismiss what they don't understand, as it is an easier option. Lupus is a cruel mystery that unfolds very slowly. At times it is an invisible torture, unpredictable on any given day. We can never know what each day will present. It is intense, unrelenting pain, a daily arduous battle that affects the entire family, not just the patient, leaving everyone feeling helpless. However, lupus is invisible to others, but not to us. And I promise you, lupus is real. I've written down some notes because I can't remember everything I need to say in order of events, and also because of some of the times that I was not fully aware of what was going on. So I continued to work as a nurse and a student, so stress was inevitable and definitely a contributing factor to the ill health I was experiencing. I felt I had the flu every day. Getting out of bed was a daily struggle. I often felt like I was hit by a bus. Insomnia was also prevalent, but there were days when I was so exhausted after a 12-hour shift that I would have a good sleep, but I would wake up feeling chronically fatigued. Some of the common symptoms that persisted was early morning muscle and joint stiffness and pain, weight loss and weight gain, mouth ulcers and lesions. I remember having a butterfly rash at one time, no clue at that time what it was. I started to get sick very often. I felt depressed, not being able to articulate how I was struggling, and I worked in a fast-paced environment. I struggled to get through my shifts. My hair was thinning out in patches. My sight was troubling me. I couldn't focus with the brain fog, but I had a dream I had to fulfill. I wanted to become a registered nurse, and I pushed past all these challenges and chose to continue my studies. In 2015, I spent most of the year consulting doctors and specialists, trying to find answers and possibly go on a treatment to relieve the symptoms so that I could function without pain. Some of my colleagues would notice that my pace was slower and I was struggling, and they would help me out. And I would try not to work with patients that were contagious, but it wasn't always possible to avoid that in a hospital environment. I remember consulting doctors, and they would leave me feeling like this was just a figment of my imagination. There were days I would be so angry with myself and start to doubt if all this is real. I felt like I was losing my mind. Eventually, I struggled. And even though I struggled, I would put off going to the doctor. And I ended up suffering in silence. I knew something was seriously wrong with me. I was scared. I became very quiet. I rested a lot on my off days to be able to cope at work. That felt so strange as I was super mom on my off days, trying to compensate for time lost with my children. My family was very concerned. I was not myself at all. The fear was that I will die and not be there for my kids. They were still so young. I lived with this fear for a long time, thinking that lupus is and rheumatoid arthritis is a death sentence. And these days, I was unable to work. I was sometimes forced to see a doctor for a sick note because I felt so ill. I couldn't function looking after sick people while I myself am sick. And some of them pinned my symptoms down to depression. I experienced firsthand the lack of empathy from healthcare professionals, the stigma attached to being misdiagnosed and misunderstood. I was spending a lot of money on doctors who had no answers and no compassion. Finally, in 2016, I was doing doctor's rounds with a rheumatologist, and I mustered up the courage out of desperation to ask her if she thinks that my symptoms are just depression and nothing else. Her approach and her response to me was one of kindness, one of empathy, and she asked me to do some blood tests, which I did, and make an appointment to see her. So a few weeks later, I consulted with doctor, and that was around October 2016. After her clinical examination and my blood test results, she confirmed that I have rheumatoid arthritis. She started to explain the treatment I had to undergo, and the words that stood out for me was no cure. My entire life flashed before my eyes, and everything else she said was a complete blank to me. I knew in that moment I had a massive fight on my hands. I was 36 years old, at the peak of my career. I was successful, a wife, a mom of 2 young kids, and diagnosed with an incurable disease. The rheumatologist started me immediately on DMARDs, which are disease-modifying anti-rheumatic drugs. Some of you who have lupus might be familiar with the baseline treatment, which is prednisone, methotrexate, plasmaquine, and folic acid. From here onward, I started to experience a lot of side effects from the medication. I went through a process of elimination, immunosuppressants like cilizopyrin, azathioprine. I was also on cyclosporin. At one time, I was on chemotherapy for lupus, cyclophosphamide, until I became extremely ill, almost dying and lifeless, susceptible to all types of infection. I was also admitted in 2017 for 3 weeks in hospital with a severe lung infection, with asthma. A pulmonologist diagnosed me with a restrictive lung disease after a series of intense tests and investigations. The rheumatoid arthritis affected my lungs, and I couldn't cope for a while without oxygen. From here on, there are some blanks, as I was not aware of what was going on. I would be confused for days and weeks. on end. I got more and more sick and started to complicate. However, through all of these setbacks, I was very successful in my training and I became a registered nurse. I was placed in the ICU department, and whilst I worked there, because I was working in such close proximity to the patients, I would develop recurring lung infections and prolong hospital stays. By this time, after long-term prednisone, I developed comorbidities, diabetes, and hypertension. My hair fell off. I was bald in a hospital bed, extremely ill, fading away. And I remember doctor came in and said she wants to test for lupus. A few days later, she came in and said she has bad news. I have overlapping autoimmune diseases. I tested positive for lupus in 2019. However, doctor feels I've had lupus for many years before I was actually tested. I was having a severe lupus flare and we needed to switch from chemotherapy to biologics. She stopped the chemo treatment and we had to apply to medical aid for biologics, which was basically my only option medically. I went onto Cellcept, mycophenolate Tiva, after the kidney biopsy that was done by a nephrologist because I had proteinuria, which is protein in the urine. I was diagnosed with nephropathy, nephritis, and a condition known as FSGS, focal segmental glomerulosclerosis. Basically, the kidneys were struggling to filter waste, which can lead to kidney failure. We needed a very expensive biologic drug, which was continuously being declined by the biologic board of the medical aid. And by this time, I had built up a very negative sick leave profile, as you can imagine. At work, I was on unpaid leave as well. And after much deliberation, after 16 years of nursing, my rheumatologist told me I had to be medically boarded. It was non-negotiable. Considering how ill I was due to the rapid disease progression of the rheumatoid arthritis and the systemic lupus erythematosus lupus, with organ involvement in my lungs and kidneys and being misdiagnosed for so many years, I was crushed. I was devastated walking out of nursing. I had worked so hard and I couldn't believe I was in this position. Nursing was the only skill set I knew. It was my passion. Medically boarded now, and I was going through a medical boarding process, which was very long and stressful as well. My third kidney biopsy was done at a different hospital during the COVID pandemic. I was admitted in the maternity ward in order to be isolated. I looked pregnant because my kidneys and fluid retention, and every day I would receive cards on my food tray which read, "Good luck on the delivery of your baby." I just received a very poor prognosis that day from the nephrologist. He said if I do not get that biologic drug, I would not survive much longer, as my condition is so complicated and complex and it is too far gone. I remember standing at the window in the ward, looking out the window and thinking the world goes on when our world stops. I know that death is certain, we will all die, but I was not prepared to die prematurely. I cried and I gave it a lot of thought of what was said, and I cried again. And I decided in that moment that I will live. I knew God would grace me time and sustain me. And I cannot reiterate the power of a sound mind. I couldn't stand on facts but faith in God because it was not in my control to fix this. I was discharged and went back and forth to hospital and trying to get the drug I needed with many failed attempts. I was lying in bed one day with a bald head, a pen and a blank page. But I had a sound mind. Physically, I didn't look good, but mentally, I was strong. I wrote a book. That was not my skill set. I was determined to find my purpose beyond lupus, beyond all the adversity I was facing. I had no funding for this book. I used what I had in that moment and I started to write. I knew this book was going to make a difference to many people. It was not my dream to publish a book, so it was God's debt. I am a published author of a book titled The Show Must Go On. And as cliche as that sounds, in essence, that's what we are all doing. Showing up for life every day, ready or not, we wake up, we dress up, practice a smile, and show up and make lupus look easy. Because by showing up, half the battle is won. There are days lupus knocks us down. Take a break, but don't stay there. The Show Must Go On book is not just a legacy I want to leave behind one day. It is a legacy that I live every day when I show up for life. Since 2016, I have had 6 surgeries, 3 kidney biopsies, numerous ER visits, and over 30 hospital admissions. If you're watching this today, this is my message. My message is that if I survived all this, you can too. If today is a bad day for you, Rumi said, if all you can do is crawl, start crawling. Don't ever cave in and give in, because giving up is not an option. After 4 years and 7 declined applications for the biologics, I finally got a yes from the medical aid. After much perseverance, tears, and pain, I persisted and emailed from my sickbed many times and fought to get this drug to have a better quality of life and to live longer. I started my infusions in February this year, and I will continue to receive infusions until I reach remission. I have not reached remission yet, but I remain hopeful and full of faith. I know the reality of lupus. I have bad days too. I cry too. And I grieve for the life I once knew. But when I'm done, I wipe my eyes and I embrace the life I now live with gratitude, and I make every moment count. There is life beyond lupus. I hope that you will find your purpose and live and thrive beyond lupus. This is my story. I condensed it as much as I could with everything that I could remember, and I hope that it has encouraged somebody today that's listening. Please subscribe to my YouTube channel as I will be posting new content. My book is available on my website, and you may order your copy on there. My website address is www.theshowmustgoonbook.co.za. You can follow me on social media as well. My website will also update you on all the work I am currently doing, all the work I'm currently involved in creating lupus awareness. Thank you for listening. My hope is that somebody out there is impacted enough to start living again. Until next time, thank you for listening. God bless you. Love you guys. Keep the faith.